Hi guys, welcome back. In this video we shall be talking about tuberculosis. Tuberculosis is very common in developing countries and underdeveloped countries. Along with this, the treatment is very long. It can have a lot of complication. A lot of people die due to tuberculosis. Along with this, you can infect another people if you are infected yourself by tuberculosis. So that's the problem, and it's a very big public health problem. So how is this tuberculosis caused? It is caused by a bacteria. It is known as mycobacterium tuberculosis. Okay, so how will you have the infection is by two routes. Either you are consuming milk that is unpasteurized, then you can have mycobacterium tuberculosis, that is tuberculosis. You can have this infection. Along with this, if a person is itself having tuberculosis and if he or she sneezes or coughs very near to your face and you inhale the droplet, you can develop tuberculosis. Now this tuberculosis is caused by droplet infection. That means if you sneeze, if you cough, there are lots of droplets coming out. In that droplet, this mycobacterium tuberculosis organism is lodging there. So if you inhale that, it goes to your lungs, and then you can develop the tuberculosis infection. Now, unpasteurized milk and from infected source, you can develop the tuberculosis. Now, what are the symptoms that you know that you're having tuberculosis? The symptoms are that you will be having fever for around 2 to 3 weeks. 2-3 weeks you will have fever. Along with this, you will be having decreased appetite. That is, you will be having anorexia. That means you won't be feeling like to eat anything. Okay, you won't be feeling hungry. Along with this, you will be having weight loss because you're not eating anything. You will be having weight loss. Along with this, you will be having dry cough. That means there will be no sputum. Along with this, you will be having night sweating. Now this night sweating is very important because whenever you sleep at night, whenever you wake up in the morning, you can see that your clothes are wet or your bedsheet is wet. Along with this, if someone is sleeping just beside you, he or she can tell you that yes, you are sweating at the night, or even if you wake up in the night, you can see that you are sweating. So fever, dry cough, night sweating, your decreased appetite and weight loss are very typical of you having tuberculosis. Remember, tuberculosis is 80% is infection to your lungs and 20% can be beside lungs. Okay, and that too most of the time is that this infection is spreading from your lungs to other places. That is known as extrapulmonary tuberculosis. Okay, and pulmonary tuberculosis means you are having infection in your lungs. Now the lungs is covered with a layer that is known as pleura. Even if you are having infection in the pleura, not in the lungs, still we consider it as extrapulmonary. Very common sites that can have extrapulmonary infection is your lymph nodes. Okay, then your gastrointestinal tract, because it is mostly seen in small kids because they're not able to throw out the sputum. They usually swallow the sputum, and that sputum is going to contain the organism. So if you swallow the sputum, it can go to your stomach. Most of the time this has been killed by the hydrochloric acid present in the stomach, but if it is not killed, then you can develop gastrointestinal tuberculosis. Remember, 80% is pulmonary tuberculosis, that is the tuberculosis involving your lungs. 20% is extrapulmonary tuberculosis, right? So you know the symptoms now, and what would you do if you know the symptoms? You know that you're having this tuberculosis. What is the next step you're going to do? You have to go and meet your doctor. It is very important that you have to go and meet a doctor. In the doctor session, he'll be doing any of these things. He might be taking your clinical history. That is, he might be asking, yes, are you having night sweats? Are you having weight loss? Are you feeling like to eat food or you're not feeling like to eat food? Along with this, are you having fever for how long? Are you having cough for how long? So this is how he'll make sure that you will make a diagnosis that you are having tuberculosis. Along with this, he can also do a chest x-ray. Okay, in chest x-ray also he can see tuberculosis in chest x-ray as well. There will be white spots in your lungs. That is one technique, and clinical examination is one technique. And the third technique is that he will ask you to collect your sputum, and he'll do a test that in the pathological lab, that's known as acid-fast bacilli. He's going to stain it, and then he's going to observe it under the microscope, and he'll be able to see acid-fast bacilli. Now this means that you're having tuberculosis infection. Okay, so out of these three, if even one is positive, we'll still start the anti-tubercular drugs. Remember, tuberculosis is very common, but the diagnosis is very hard as well, because it is so dangerous that even if the sputum culture is negative, even if there is nothing in the x-ray, even if the symptoms are there, you still start with the anti-tubercular drugs. Okay, so now what are the drugs that they generally use? Generally they use rifampicin, streptomycin, ethambutol, pyrazinamide, isoniazid. So these are the common drugs that they're going to use for anti-tubercular drugs. But you have to understand, every country is having their a bit slight changes. Most of these drugs will be involved. Maybe one or two are added or one or two are subtracted. Along with this, they can change with the specific dose. Along with this, they can make sure the pattern how do you take, because whenever you give medication for anti-tubercular medicine, these have been given in initial phase and a continuation phase. That's initial phase, we are aiming to give you these drugs in order to make you less infective, that you don't infect to other people. And then continuation phase is that you are going to kill the bacteria completely. In initial phase, we aim to make sure that you do not spread to anybody else. That is the initial phase. Now yes, in some countries the initial phase maybe 2 months, maybe 3 months. There can be a slight variation. You have to see for that country specific, that country only. Okay, because that infection is a bit more common in that. So the guideline has been given by the government or the health ministry of that country is going to give you the guidelines. So that's how you have to do it. As I told you, the drugs will be mostly these drugs only, but these drugs can differ a bit, and the dosing can also differ, and the way you prescribe can also differ. So you have to understand that if you are staying in developing countries or underdeveloping countries, or you are practicing in government hospitals, you are practicing in any hospitals, it is very high chance that you already have tuberculosis infection. Yes, it is very high chance that you have tuberculosis infection. It is very high chance I myself have tuberculosis infection. But our immune system is very strong and very smart enough. What it will do is that whenever the infection is there in your lungs, it is going to make a calcification around the infection. Okay, it is going to make a calcification. In order to this is not going to allow you to develop tuberculosis. Yes, you have a tuberculosis infection, but our immune system is strong. It is going to make a calcification around the infected site. So sometimes if you do an X-ray, you can see white spots. Now these white spots are calcification spots, okay? But due to unfortunate reason, if you have your immune system going down, let's say you're having diabetes mellitus, or you had a organ transplant in which you need to take immunosuppression drugs, or you are taking steroids, you're taking prednisolone, you're taking dexamethasone, all these steroids if you're taking, if you're having chronic illness, if you're having hypertension, diabetes mellitus, in these cases your immune system goes down, okay? In that cases, there can be reactivation of this infection. That means the infection is present inside your lungs, that can become reinfected. So that is the problem. So in this context, developing countries and underdeveloped countries, high chance that you will be having tuberculosis. But do not worry, this tuberculosis is not going to affect you, nor is going to affect someone else, because it has been calcified by your immune system. In case if your immune system drops due to any reason, this can become reinfected, or it can become infected. So you don't want your immune system to go down. So you always want to have a healthy diet, good sleep, good amount of multivitamins. You want to avoid your stress, reduce your alcohol, reduce your smoke, reduce your toxins. That is how you can make sure that the immune system is working at the optimal level. Okay, so tuberculosis again is very common, very deadly. The treatment is very long. Usually the treatment can last you from 6 months to 9 months to 12 months. Okay, along with this, tuberculosis is difficult to diagnose sometimes. Even if you diagnose by clinically, still we can start the anti-tubercular drugs. Along with this, if you diagnose by the x-ray, still your doctor will start with the anti-tubercular drugs. If they diagnose with the acid-fast bacilli, that is sputum culture, still your doctor will start with the anti-tubercular drug for tuberculosis. And tuberculosis is common, underdeveloping countries common, developing countries common. You can spread to someone else, you can yourself die, and a huge amount of people are dying due to tuberculosis. Why it has been caused? It is caused by mycobacterium tuberculosis. How it has been transmitted? By two things. Either if someone is coughing or sneezing very near to you, that the droplets are landing to your nose and you are actually inhaling it. Along with this, if you are drinking milk that has been coming from the cow that is infected by the organism, and that milk has not been pasteurized, that is not has been boiled, and if you consume that milk, you can develop tuberculosis. Right, so the treatment pattern plan is very well given by your government of the specific country. That the guideline has been given by that. That is the guidelines that you have to follow. And the thing is that every year, every 1 or 2 years, this guidelines keeps on changing. That is the reason you don't have a fixed guideline. Okay, so you can very well go and see in your WHO website, or you can go to your own country's health education website. There will be the regimen and the pattern of the drugs will be given, and that is a pattern that you have to follow if you're staying in that country and if you're the patient of that country. Right, so tuberculosis, you don't want your immune system to go down. How do you make sure that your immune system is working at optimal level? You want you to have a very good night's sleep. Adequate sleep is very important. You have to manage your stress. Along with this, you don't want to take alcohol or smoking. Along with this, you want to minimize your toxins, that is can be toxin from your car exhaust, from your pesticides, from insecticides, anywhere. Along with this, you want to eat fruits that can help you to increase your immune system, rather I'll say to make your immune system work in the optimal level. Okay, take good amount of carrots, good amount of vitamin C, antioxidants. This will make sure that your immune system is working the optimal level. And please do not try to develop diabetes mellitus along with hypertension, or do not develop HIV. It's a very deadly combination. HIV and tuberculosis, you're most likely to die. And talking about this context now, coronavirus and tuberculosis. The coronavirus can itself cause if you're having low amount of immune system, and tuberculosis can itself cause you if you're having low amount of immune system. So coronavirus and tuberculosis again will be a very deadly combination. Coronavirus and pneumonia can again will be a deadly combination. So that's all for now about tuberculosis. Please talk to your doctor. We have tuberculosis awareness programs. Talk to your doctor, talk to your healthcare professional, go and read the authentic websites which are present in the online. And please do not avoid going to your hospitals or avoid taking the medication that has been prescribed by your doctor, by your healthcare professional, because tuberculosis is very common and very dangerous as well. So we want our country, our place, our continent, our world to be free of tuberculosis, which is a very big challenge. So that's all for now. I'll see you in the next video.